This is a step-by-step video on conducting the Asante HIV rapid recency testing. The Asante HIV rapid recency assay is a single-use rapid in vitro immunoassay that distinguishes HIV-1 infections on the basis of recency of infection. It is intended for use with blood, both venous and finger stick, serum or plasma specimen. POC test kit Asante HIV rapid recency assay test kit include test strip individually sealed in a foil pouch, specimen collection loop, and sample buffer tube. Additional supplies are ballpoint pen, fine tip marker, timer, sharps container, biohazard bag, disposable liner, job aid, paper towel. The supplies needed for capillary blood collection are a lancet, alcohol swab, gauze square, plaster or bandage, disposable gloves. Before you start testing, check the kit before use. Use only kits that have not expired and test devices that are not damaged. Keep kits stored at 2 to 30 degrees centigrade. If kits were stored below room temperature, bring them to room temperature before testing. If using previously collected specimens, bring stored specimen from refrigerator to room temperature. Always use universal safety precautions when handling specimen. Arrange all supplies on the bench. Have a timer preset at 20 minutes. Use the fine tip marker to label the sample buffer tube with the sample ID number. Place the tube on a stand. Remove the lid and discard into sharps container. Wash your hands thoroughly and put on a new pair of gloves. Position participant's hand palm side up. Choose whichever finger is least calloused. Massage and apply intermittent pressure to the finger to help the blood to flow. Clean the fingertip with alcohol. Start in the middle and work outward to prevent contaminating the area. Allow the area to dry. Hold the finger and firmly place a new sterile lancet off-center on the fingertip. Firmly press the lancet to puncture the fingertip. Dispose the used lancet in the sharps container. Obtain a loopful of capillary blood directly from the finger prick site. For previously collected whole blood samples, mix by inversion 6 to 8 times. Confirm the loop is full without bubbles. Transfer the loopful of blood to the sample buffer tube. Discard the specimen collection loop in the biohazard bag. Tear open the foil pouch. Take care not to touch the middle of the strip. Confirm the pouch contains a desiccant packet, otherwise discard and use another. Insert the test strip into the liquid in the sample buffer tube. Arrows printed on the strip should be pointed downwards toward the buffer. Let the sample buffer test strip stand on the rack. Start timer. Remove strip from sample buffer tube at 20 minutes. Touch the lower end of the strip to paper towel and drain excess buffer. Lay it flat and read results immediately. Test results can be interpreted visually or by a test strip reader. The control line is a functional control line that indicates that the assay was performed as recommended. Absence of the control line indicates either the device is not functioning properly or that the sample collection was inadequate or improper. The verification line is meant to verify HIV positive status as previously determined by an approved HIV testing algorithm. A test should also be considered invalid if missing the verification line, but shows a control and long-term recency line. The long-term recency line is a test line to differentiate if the specimen is either long-term infection when the line is present or recent infection when the line is absent. The intensity of the line does not change the interpretation of the result. The presence of all three lines indicates a long-term result. The presence of the control line and the verification line indicates a recent result. If only the control line is present, that is a negative result. An invalid result is obtained when the control line is absent or control line and long-term line are present without the verification line. Make sure that the specimen IDs are entered on the form prior to testing. Record the results of all tests performed, including the invalid tests. For each row, write the participant's ID, mark the appropriate cell to indicate which lines were present on the test strip, circle the recency test interpretation as the final result. For detailed information, please consult your kit insert.